integration of mental health services in our schools, it's a really key partnership. Because for so many young people, whether they're in elementary, middle, or in high school, there are lots of issues they may be struggling with, having to do with circumstances in their family, with the health of a family member, or psychological or mental health issues that the individual is struggling with him or herself. So those things are going to surface and be apparent to classroom teachers and people who work within the school system. The more there's a strong partnership with local mental health, it really allows for a good range of services to be available to support our students so they can flourish in our school system, but also get the assistance they need with coping skills and learning how to manage adversity in their own lives, whether that's through a psychologist or a school counselor in the school setting, or whether it's linking them to a local mental health center if they need some other services in addition to what they're able to get in the school. But I think those partnerships are really key in serving our students and serving our families well in the community. School is a key place for that, and in my mind, it's just part of learning an essential set of skills to function well in life. And not only identification, but having available good education to the kids in the schools and to the staff in the schools to be able to not only recognize, but know how to intervene at an early point in a way that's going to be most effective. Whether that's helping to nip a problem in the bud and help a student really do well with some intervention at an early point, or getting them linked with the services that they're needing. But you're right, if schools don't have the resources they need to maintain their student support services, the psychologists, school counselors, guidance counselors, then there's a better chance that some students are going to fall between the cracks, won't be identified, won't get the kind of supports they need to help them stay on track with their own lives and to function well academically. So you're right, any of those things that move further along without identification are going to be more costly to address at a later point, and you're likely to have much more complicated situation to have to deal with at a later point in time. We know that many of the more significant mental illnesses first rear their heads in young adulthood, late teens, early 20s, during major life transitions. That's often the point that comes up. So you can see the importance, especially at the high school level, of having those good supports available there for kids as they're making a really big transition from high school to college, and having those student support services available to help them really stay on track. So that's just another reason, because with those kinds of difficulties, if there's a student who's really struggling and that's not identified, and then they head off to college and find they're really struggling their freshman year on both fronts, both for the high schools, but our colleges, having good student support services available is really key to students who are undergoing all those important life transitions. Having good information available, good education, things that are likely to really help with preventative efforts is worth its weight in gold. So having those things available to kids at the time in their life when it's most important is key, but having good supports for that and good ways of identifying in advance things that are important for kids to be aware of regarding substance use, issues with addiction, suicide prevention, and just general good mental health care. That's a really key time in life to have that information readily available, and having resources that kids know they can meet easily with people and get the kind of help that they need.